Happy New Year. I thought I'd come on and say Happy New Year and try and answer a couple of questions that have been posted on my videos recently regarding different toothbrushes and that kind of thing. It's a tricky one with toothbrushes because I think it honestly depends on which one you've got, what style head you've got, and how well you use it. The Department of Health recommend oscillating rotating, which tend to be the Oral-B ones. However, saying that, they've just brought out a new IO toothbrush, well, not just a year or two ago, and there's loads of different versions of it. And they don't oscillate, they vibrate more than oscillate. However, they're excellent brushes. They're quite expensive, but at the moment they've got lots of offers on. You can always pick up a bargain somewhere. You need to just make sure you're brushing for 2 minutes. If you're brushing longer than that, I would probably almost say you're over brushing. You don't need to. As long as you're interdental cleaning, so I can get around my mouth in about a minute, but it depends on your mouth. It depends on how crooked your teeth are, if you've got fillings and crowns to try and floss and TP around, and that kind of thing. If you find the TPs bend, I would probably advise trying a brand called Stoddard, Stodd, ORODDARD, and you can get them on Amazon. They come in the same colour coding that TPs come in. I would almost say if your TP colours are orange or pink, the very tiny colours, you might be better off flossing if you struggle getting them in and they bend. A lot of these techniques are angulation. If you book in a hygiene appointment in your local area, the hygienist should be able to size each individual space in your mouth so that you have the exact brush or floss technique that you need. If you take your toothbrush and your belongings like interdental cleaning aids and toothpaste and that kind of thing, take it to your appointment. The hygienist can demonstrate everything in your mouth, which is really useful. I try and get all my patients to bring their bits and bobs with them at each appointment, and then it just saves, faffing around, and I know what your toothbrush head looks like, or if it needs changing, or if a different toothbrush would suit you better. Some patients have very small teeth, so mine are quite big. I've got quite big teeth. But some patients are quite tiny, and therefore a child's toothbrush, if they're brushing manually, for example, will be more efficient than an adult manual size one. Some of the manual size heads are massive, and they're all kind of a rectangle shape, and they just don't fit around each individual tooth. So it's just kind of using your common sense. If you do notice any bleeding or any swelling of the gums, it's just plaque and bacteria. It can easily be removed. If you do have advanced gum disease, or starting to notice a funny taste in your mouth, or if any teeth are feeling loose, don't panic. Go and see an experienced hygienist who knows what they're talking about. They can do deep treatment under anaesthetic, so you won't feel anything, and they can deep clean under there. But it's all about consistency, disturbing the plaque, the soft plaque that we build up every day. So the bacteria have got nowhere to live. They've got nowhere to sort of sit and cause inflammation. And inflammation is bleeding, swelling, and redness. So the more efficient you are at cleaning, the more likely you are to prevent gum disease, have a healthy mouth, and keep your teeth strong in the bone. It's not rocket science. It's just based on evidence. And some mouths are definitely trickier than others, especially if you've got a gag reflex, and every time you put your toothbrush towards the molars, you can gag. There's different ways of combating that. You can get interspace brushes, which are much smaller in size, and you just need to drop your tongue down, and then you'll be able to get around the insides. It is just technique with a lot of these things. But again, if you're unsure, just book a hygiene appointment. They know what they're doing. They've done their degrees and they've studied hard, so that if they don't know, you need to ask them and they will tell you. I hope that is helpful for 2023, and I hope you're all okay and not feeling too down and getting about and moving and brushing and flossing. There's always time to do these things in the day, but it's just prioritising and making time for yourself. I hope this helps. If you've got any comments, just message me on the videos. Happy New Year.